Now, South Africa's COVID-19 cases have indeed increased to 35,812, unfortunately. Health Minister Dr Zweli Mkhize confirmed this earlier today during the second day of his visit then to the Western Cape. He's assessing the readiness of the province to deal with an expected surge in COVID-19 cases. The province has the highest number of infections in the country. Let's get to Mariska Botha now, who is in Paarl. It's a good afternoon to you, Mariska. A sense then from not just community, but also the minister, that indeed the province could be ready to deal with things in a moment or two?
Yes, he certainly did express his satisfaction with the speed at which the province is addressing or trying to address the situation. Of course, what they're busy working on now is getting enough beds ready for that expected surge, which should be coming through within the next month or so. We are in Paarl at the moment. I'm just going to step out of shot for one moment so you can see in the background. This is one of the facilities that will be housing people with COVID-19. Or serve as an intermediate facility where they might keep people who cannot quarantine at home, and they will be brought here and quarantined at this facility. So he did express his satisfaction, and he also assured the Western Cape government that all the funds, like in all the other provinces that expressed concern about that, funds will be available, everything they need will be seen to as quickly as is possible. And a very important thing that he raised this afternoon, of course, is that he said the discussions between the national government and the private health sector in terms of using hospital beds in private hospitals will be finished tonight by this evening. Thereafter, it will be up to the provinces to deliberate with various hospitals to get beds if necessary. Now, he also emphasized that if people are then facilitated in private hospitals, there will be a standard protocol that will be used to treat everyone with COVID-19. So it will not be a case of someone in a health facility of the department versus a private hospital will be getting different services. They will all be getting the exact same health care that everybody would be getting. He also spoke about, of course, the backlog of numbers. That is an issue in all the provinces. But he says that's to be expected given the great number of tests that's being conducted. It's between 17 and 23,000 tests per day that's being done. He says he's satisfied with that. And very importantly, he expressed that if someone goes for a test and they are part of that group that is waiting for results and the results are delayed, they should be treated clinically by their physicians and should be treated as if they have the virus. So that would mean self-isolation. And then, of course, if they cannot do it, like in highly densely populated areas, they will be accommodated in field hospitals, for example, like this one would be, and of course the biggest one in the Cape Metro, which will be at the Cape Town International Convention Centre. So even though you are waiting for results, he says there shouldn't be reason to panic. You should be in contact with your physician the whole time, and then while you wait for it, even if you are negative, because you won't be getting results soon, it should be treated as a clinical case of COVID-19 positive, and then all the procedures that should be followed for a person that is positive should then be in place, including the self-isolation, which is critical.
Yeah. So at a point like this, then, are we saying that officials perhaps in the area are a whole lot more aware of what needs to be done, a whole lot more succinct then with the basis from here on in? It becomes the epicenter, and fears around going back to level 4 for the Western Cape, of course, must be running rampant as well.
Yes, certainly. Of course, that was expressed right at the beginning, depending on how the virus spreads and reacts. A province or even a district metro could be put back onto a different level if needs be. Currently, the whole of the Western Cape is on level 3 like the rest of the country. And like we heard from Dr Zweli Mkhize earlier, saying that he is satisfied thus far with the readiness in the province to be able to deal with that possible surge that is coming. Now, of course, there is also something called a hotspot intervention, where they send there's a strategized plan, and experts are sent into the area to deal with the issue, such as the case in Ceres, for example, where the figures have come down drastically because of that intervention. And Dr. Mkhize emphasized again today, the most important part of that is tracking and tracing and isolating and quarantining people, which should be followed everywhere. So every time that there's an outbreak, which they call a cluster outbreak in a certain area, this is the protocol that will be followed. The person that has tested positive, tracking and tracing those who were in contact, test them, quarantine them, and then make sure that they get the necessary care, which is the protocol that will be followed everywhere, not just in the province, but certainly health authorities here feel that they are on top of it. They are in different stages of readiness with the field hospitals and so on, but they say this facility, for example, will be ready by the middle of June to deal with the issues in this particular area.
Mariska, Botha, they're giving us a succinct rundown really of what the Minister has really put forward. The health MEC as well for the Western Cape, Noma French Mbombo, will also, of course, try to give as much as possible when it comes to all of that information as well. Thank you so much there to my colleague.